Joining us once again on the programme, the Minister responsible for the vaccines rollout, Nadhim Zahawi. Mr Zahawi, good to see you this morning, and plenty, of course, to discuss about the ongoing rollout. But let's not let the Health Secretary be the only person that gets congratulated on this programme. We hit that 15 million target. As the Minister responsible, you've clearly played a big part in that, so well done.
Thank you very much, Neil, and it's an incredible team that has delivered that target. Not least Brigadier Phil Prosser and 101 Logistics Brigade, but of course the NHS, the GPs, the nurses, the pharmacists, the volunteers, the army of vaccinators, and of course the volunteers marshalling people, making sure those 4 cohorts, those most vulnerable people, were offered the vaccine and were able to get through vaccine sites in as smooth a way as possible. So I stand on the shoulders of heroes, and I feel in many ways like a bit of an imposter, but we focus on making sure now we deliver the next target, which is we offer the vaccine to all 5 to 9 cohorts. So that's in total, we'll be at 32 million people with the first dose. And of course, the second dose. This week is the first week, Neil, where we've been able to, with the supply stabilizing, send out the schedules over the next 3 weeks for people to begin, of course, to deliver for cohort 5 and 6, but also to book in the second doses, which will begin in hospital hubs in the final week of February, and then in primary care and GPs from the 1st of March onwards.
Can we then, Minister, perhaps talk just a little about a subject that I know is concerning you, vaccine hesitancy. An interesting piece of information that had not crossed my radar, I have to admit, that some people within the black and minority ethnic, Asian and minority ethnic communities are saying that they are concerned about taking the vaccine because they're concerned that it may affect fertility, they're concerned that it may affect them if they are pregnant. Can you speak directly to that and provide some reassurances?
Absolutely. There is a tsunami of disinformation, misinformation, which we have a unit across government that is dealing with the technology platforms to take down some of this fake news in terms of effects on fertility. It does not. In terms of pregnancy, you can have your vaccine, of course, once you've had a discussion with your clinician to make sure that your own physiology allows you to do that. It's one of the issues that Simon Stevens, the chief executive of the NHS, addressed last night, which is this sort of the pandemic itself and then a pandemic of misinformation, or as I just refer to it, a tsunami of misinformation on social platforms. And it's very important that we continue to deliver accurate information in people's own languages, but of course in their communities. We're translating everything into 20 languages, from Arabic to Farsi to Hindu to Polish, across the board. We have to reach those hard to reach groups, because although, and you've heard me say this before, vaccine positivity in the UK, so people, adults saying they will take the vaccine, is at 89% of the adult population. The 11% that are vaccine hesitant or have questions skew heavily towards some of the ethnic communities, the Black and Afro-Caribbean communities, the Indian and Pakistani and Bangladeshi communities. And we are working with those community leaders. We've put £25 million to work through local government. And of course, most importantly, I published the uptake strategy on Saturday, sharing data with local government, the NHS and local government working hand in hand to make sure we reach those groups with the information and, of course, the access. One of the things we've found, Neil, is actually a lot of people want easier access to be able to go and get vaccinated. So we are assessing lots of pop-up sites. At least 200 new faith group sites have come forward, and we're looking at those as well. We're already vaccinating in the Hikma Centre in Batley that the PM visited, and of course the Abbas Mosque in Birmingham and cathedrals around the country. It's about access that I think will be our focus on that, and data sharing will hopefully get us to the high levels of acceptance from Black and ethnic minority communities.
Those faith centres being used for vaccination, I'm sure, will advance the campaign against disinformation. But again, a suggestion, a very specific suggestion coming from within the Muslim community, is that there are perhaps significant numbers of people not taking the first dose of the vaccine because their second dose would fall in Ramadan. Now, I don't know enough about Islam to say whether or not this is something that would be prescribed by Islam, but clearly there are concerns. Again, speak very specifically to this community, if you can, Minister.
Yeah, very much so, Neil. So, of course, we make already plans for Ramadan when people are fasting, and make sure that, as we do with other communities, look into their festivals. Purim is almost upon us for the Jewish community. And of course, Ramadan is something that we've got to make sure that the system adjusts to be able to deal with that. But faith leaders in the Muslim community have come out very clearly, whether it's the East London Mosque or the Abbas Mosque in Birmingham, and said that actually you have to come forward and take your vaccine. It protects you. We know that BAME communities are disproportionately impacted by this virus. So come forward and take the first dose, and we'll make sure that we will accommodate any issues around Ramadan or any other religious festival to make sure that you can get your second dose safely and in the correct way.
Good to hear, Minister. I wonder if we can talk about some of the measures that were introduced pretty much first in a response to COVID-19, social distancing and mask wearing, a suggestion picked up by our Deputy Political Editor, Sam Coates, that the scientists advising the government are wanting to see those measures kept in for the foreseeable future. Are you minded to see that happen? I mean, I suppose the point is that people have been hearing ministers talking about a return to normality. For many people, social distancing, not being able to hug your friends, wearing a face mask, that doesn't fall within plenty of people's definition of normal.
You're absolutely right. We are all pro-social animals. It's in our DNA that we want to socially interact. We want to hug our children, our grandchildren, our friends. I would say this: we have to be data-driven rather than just date-driven. We have to follow the evidence from SAGE, from the scientists, to make sure that if we are able to control this virus better. Obviously, our main our way out of this pandemic is our vaccination program, which we are making sure that we deliver as quickly as possible, protecting the most vulnerable and then moving to the whole of the adult population. We want to be able to, by September, have offered the vaccine to the whole of the adult population. But with that level of vaccination, which hopefully we'll see the data on infection rates coming down, transmission, there's some good data from Oxford, but that has to be peer reviewed, and we wait for our own data from the Public Health England surveys that are being conducted. But with that, surge testing, tracing and isolation, and any other measures, whether it's mask wearing or social distancing, I think we have to be driven by the data rather than just dates. That's my message to your viewers is, if we look at the evidence and share that evidence, people are able then to make those decisions for themselves. And I think that's the right way to do that. The Prime Minister will be saying more on this on the 22nd of February in terms of the roadmap back to reopening schools, hopefully on the 8th of March, and then gradually reopening our economy. But it has to be data-driven, evidence-driven, rather than just relying on what we all want to see, because we're all anxious to want to get our lives back and our economy back on its feet as quickly as possible.
Yeah, and again, this kind of all takes us back to the Prime Minister repeating yesterday something that he said before. Look, case numbers are going to be incredibly important in determining which measures are relaxed and so on. I suppose the question there is, look, we are testing more than we ever have done, which is undeniably going to register more cases just because of that. I mean, if we look back to when case numbers were low last summer, July the 4th, when the pubs reopened, it was 624 cases that we were registering, with far fewer tests going on than there are now. So I'm just wondering, what kind of level do we need to bring it down to before we start talking about what we're going to be hearing, next Monday?
Well, I think you're right to look at whether it's case numbers, and you're absolutely right to say that we are now, both in terms of capacity, at about 800,000 PCR capacity tests a day. and of course the level of testing. We're almost touching that on average a week, about 600,000 to 700,000 tests a day per week, as well as of course many more lateral flow tests through local government, through businesses, as well as people in the NHS and in the healthcare system having those twice a week tests to make sure that we remain on top of the virus. But again, the Prime Minister's right to say that where we are today, in terms of number of people in hospital, in terms of case numbers per day, it's still far too high, and we want to make sure we bring that right down. But I wouldn't want to speculate on this until we see more data, and of course, ask those who are expert, the scientists, the SAGE, and of course, the chief medical officer, to look at this and to advise us accordingly, and be data-driven. We all want the same thing, Neil. We want to make sure we reopen the economy as quickly as possible, but of course, make sure that it is sustainable. That's the important thing. Hence why we've got such a strong vaccination deployment campaign, but also the Prime Minister's already asked us to think about not just this vaccination deployment, but what will happen if we need a booster in the autumn, which we're planning for, and of course then an annual vaccination program for future years if we have to deliver that, if the virus has mutated to a level where we need vaccine variants and of course annual vaccination programs. All of that will be discussed in the mix, and of course the PM will set out the roadmap on the 22nd of February based on the evidence.
Just to interrupt, sorry to interrupt, Minister, but just one thing that the Prime Minister did mention yesterday, lateral flow tests to essentially enjoy a night out. Now, there are a couple of problems with that, obviously. Case numbers are far too high for mass use of lateral flow. Also, are we really going to be testing people for access when there are so many false positives?
Well, so I think...
Sorry, false negatives, I should say.
Yes, and I got your point. Absolutely right. So I think what the Prime Minister actually said is it will be a combination of the national vaccination program becoming really successful, reaching that 89% of the adult population, where currently, according to all the surveys, including the Office for National Statistics survey, that 85% of the adults say they will take the vaccine. The latest stats I saw, I think from Ipsos Mori, said 89% said they will take the vaccine. So what he was talking about is a world where we have the adult population vaccinated to those high levels, and then rapid testing technology where you can get a quick test done and then be able to use that as a way of reopening, whether it be theatres or the rest of the economy.